As many of you probably know by now, I'll be leaving Louisville to accept a position at the University of South Florida's College of Public Health in Tampa. I will certainly miss Louisville. I'll miss the exciting new construction going up in the city, such as the Yum Center. I'll miss my drive to work each morning along scenic River Road, but most of all, I'll miss the many friends I've made in Louisville and the many colleagues I've been fortunate to have worked with. With all of us working together over the past 7 years, we've taken strides towards making Louisville a healthier place. We've made progress toward making the city a place where all its residents have the opportunity to make choices that allow them to live long, healthy lives, regardless of their income, education, or ethnic background. On today's show, we'll take a look at some of the things we've worked on and accomplished together over the last 7 years, so stay tuned. We'll be right back. In 2004, Mayor Abramson and the Department of Public Health and Wellness began to implement the Mayor's Healthy Hometown movement. The idea was to create a new culture in Louisville, one in which physical activity, good nutrition, and optimal health were the community norm rather than the exception. We dubbed it a movement rather than an initiative or a program because it is ongoing and evolving. It is a change in the way people take charge of their own health.
You know, in 2004, Dr. Troutman came to me and started talking about the importance of creating as healthy a community as possible. And he wanted to use the mayor's office as really the energy behind creating a healthier community. And I said, okay, so we'll call it the Mayor's Healthy Hometown Initiative. And he looked at me and he said, you know, health is not an initiative. Health is a movement. It's something that initiatives begin and they end. Movements start and then they pick up steam and they stay with you for generations to come. And so I took his advice, and as we developed the program, it was called the Mayor's Healthy Hometown Movement. About, I don't know, 3 months later, 4 months, well, no, it was several years later, because that was in 2004. Several years later, I was in Washington, and Mrs. Obama, the First Lady of our country, invited about 6 mayors to visit with her because she wanted to do something in terms of carrying the message about the problem with obesity with our children. And she began talking through it, and she asked each of us what we were doing, and I talked about the Healthy Hometown Movement. And I referenced to her, it's not an initiative, it's a movement, and I recounted what Dr. Troutman had told me. And about 3 days or 4 days later, the President of the United States gave his State of the Union. And he made reference to his wife that was in terms of her beginning to focus on a program that would do something to stop the expanding obesity of children in our country. And he looked literally up to where she was sitting and talked about her movement, not initiative, to bring about the change. Dr. Troutman was the guy that started all that, and I was glad to be a small part to be able to carry that message. And now, as you know, the Mayor's Healthy Hometown Movement involves everything from eating nutritiously, to exercise, to making sure that we have the right fruits and vegetables in every neighborhood in the community for folks to be able to purchase. So it's been an exciting experience and a movement, hopefully, that will go on for years to come.
The Mayor's Healthy Hometown Movement has taken many forms. It's included worksite wellness initiatives. It's included the very successful Mayor's Hike and Bike, in which thousands of people participate each Memorial Day and Labor Day. The Mayor's Healthy Hometown Movement has also included events to get our children more active, such as the Tommy Smith Youth Initiative and the annual Walk on the Waterfront that draws thousands of elementary and middle school students every year. In March of this year, the work of the Mayor's Healthy Hometown Movement got a huge shot in the arm when Louisville was awarded a $7.9 million Communities Putting Prevention to Work grant from the federal government. The grant is funding 23 citywide strategies that are making more healthy choices available to Louisville citizens. As a result of the grant, we are now establishing farmers markets in neighborhoods throughout the city to make fresh, locally grown produce more available. In food deserts, that is neighborhoods that do not have ready access to a supermarket that sells fresh fruits and vegetables, we're establishing Healthy in a Hurry corner stores. Before becoming a Healthy in a Hurry corner store, many of these establishments offered only junk food, cigarettes, and liquor. We're providing refrigeration units and technical support to the Healthy in a Hurry corner stores that make it cost-effective to offer fresh fruits and vegetables to neighborhood residents. Thanks to the grant, We also now have the resources to give consumers the information they need to make healthier choices when dining at Louisville restaurants. We're working on a menu labeling initiative that will include a listing of the caloric content of each food item next to the price. We have already begun working with local restaurants and are offering them technical assistance from chefs and dietitians as well as financial assistance to reprint menus and menu boards. The Communities Putting Prevention to Work grant is also enhancing our community's infrastructure to support bicycling, walking, and other physical activity. This includes strategies to increase access to Louisville Metro Parks and the 40-mile Louisville Loop through enhanced public transportation to the parks. It also includes enhanced community policing so that neighborhood residents feel safe to get out and exercise in their neighborhoods. In 2005, after much community debate and soul searching, the Metro Council passed Louisville's first smoke-free law. The first law was a partial one that exempted bars and many restaurants and had limited success in improving the indoor air quality in Louisville. By 2006, the people of Louisville were ready to support a new and improved law that banned smoking in virtually every public place in Louisville except Churchill Downs, the home of the Kentucky Derby. Just days after a judge overturned the law in December 2007 because it exempted Churchill Downs, the Metro Council overwhelmingly passed a comprehensive smoke-free law that now prohibits smoking in all public places in Louisville. Once considered the home of big tobacco, Louisville now has one of the strongest smoking ordinances in all of America.
You know, the issue of smoking is, and the concern we have here in this Commonwealth is a major concern as a result of the sickness that comes from smoking cigarettes. A lot of states, like Florida, California, have moved to create smoking bans, and Dr. Troutman and I felt it was time to energize this community to bring about a change. Lots of complaints from families that even though they were in non-smoking areas, they were afraid their children and themselves were inhaling particles that would create problems, and all the literature, as Dr. Troutman laid out for me very clearly, as did many of the physicians, the pulmonary docs in our town, shared with me, there was no question that even though you're in a non-smoking area, in a workplace, in a restaurant, in a bar, in an entertainment facility, the fact is secondhand smoke still caused cancer as a result of others smoking and you inhaling that smoke. So the bottom line was we geared up with the Board of Health, the Department of Health and Wellness, myself putting my political capital on the line to bring about a change in this community. There were many who pushed back and felt that it would be horrendous to implement a smoking ban in businesses, in restaurants, and in entertainment venues and bars. We did get it passed with a lot of help from the community as a whole, the medical community, the pulmonary docs, the Heart and Lung folks were Heart and Lung Association folks were very involved. When you put it all together, we were successful, and it's amazing. Now it's like everybody takes it for granted. There has been no negative effect whatsoever since all the restaurants and all the bars and all the entertainment venues are non-smoking and all the workplaces are non-smoking. And as a result, it's another aspect of our healthy hometown that makes this a great place to live and to raise a family here in Louisville, Kentucky.
I've always believed that good public health should be based on science and on good data. That's why in 2004 we began publishing annual health status reports for Louisville. These reports use data such as local rates of chronic disease, infant mortality rates, and communicable disease to gauge the health of the community. We also began implementing annual behavioral risk surveillance surveys to assess factors such as smoking rates and the rates in which people exercise. This data can then be used to design programs and implement services to overcome barriers to good health in the community.
Well, actually, collecting health data is a primary function of the local health department. Assessment of the community's health status is very important as far as us being able to measure how healthy or to identify health concerns in the community. Data is key in measuring how healthy we are as a people. And the data is used and reviewed by folks in positions that are able to make decisions about our health and policies in regards to improving our health outcomes in the community. So data is really important in informing the community and also those key stakeholders in the community, as well as policymakers, as far as to help us decide how we can improve the health of our community.
Words are important. The words we use to name something affects the way we think about it and carry out its mission. In 2007, we changed the name of the Louisville Metro Health Department to the Louisville Metro Department of Public Health and Wellness. There are two important words in the new name, public and wellness. The word public recognizes that the department's work seeks to improve the health of the entire community and that the interventions that the department undertakes are aimed at populations. The word wellness incorporates the World Health Organization's notions of health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Wellness means proactively promoting and maintaining good health rather than trying to correct poor health after the fact.
When you hear the word wellness, and that was added to the name, it's not about a place where you go to fix diseases or to see if you have a disease. It is about the wholeness of life. It is about making sure that you're proactive, making sure that you're educated, making sure that in all, physically, spiritually, your whole well-being, that you're always fit. Not that you're going in because you're sick, but that you're proactive, that you're always fit. And hopefully, you will be more healthy. Well, I hope that you can take this the right way, but when you say the health department, that's kind of a scary place. That's where you go to find out that, you know, you're sick or whatever. But when you add the word public to it, it's welcoming. It's saying, hey, guess what? This is for the community. This is where you can come in and get education. This is where you can come in and be protected. This is where you can come in and learn, because this place is your place. It's for the community.
The Healthy Start program, first established in Louisville in 1998, has continued to grow and serve families over the past 7 years. The program reduces infant mortality, that is, the rate at which babies die before their first birthday, in neighborhoods in West Louisville. The program makes sure that women receive prenatal care early in pregnancy and then continues to work with family until the child reaches age 2. Thanks to Norton Healthcare, Healthy Start expanded in 2009 to include the residents of Newburgh. In 2009, Healthy Start also received a major $6.4 million federal grant to carry its funding forward for 5 years. Healthy Start has helped more than 6,000 families since it's been in Louisville. The Healthy Start initiative in Louisville is one of only a very few across the country that had no infant deaths among participants from 2002 to 2005 and again in 2007. In 2006, we established the Center for Health Equity in the historic Hampton House on West Chestnut Street. It was the first such center in a city or county health department anywhere in America. The Center for Health Equity works to eliminate the social and economic barriers to good health that people of color and lower economic groups often face. The Center for Health Equity recognizes that good health depends on good policy. It recognizes that where we live, how much we earn, and how well we are educated often determine how healthy we will be and how long we'll live. Also in 2007, we launched the first of our 2 mobile health units with federal funding. The mobile health units are allowing us to take medicine and dentistry outside the walls of public health clinics and into parts of the community where people do not have access to quality health care. In 2009, we were able to get another mobile dental unit thanks to federal funds secured by Congressman John Yarmouth. The fact that the unit is mobile gives us much more flexibility in where we can deliver dental services. We can now provide dental services in all sections of the community rather than being limited to a fixed location. Tooth decay is one of the most common forms of chronic disease amongst children and adults in Kentucky. The mobile dental unit is traveling to neighborhoods throughout our community, providing much needed oral health care.
One of the only ways we can help resolve our healthcare crisis is to deal with preventive medicine. And the project that we are able to display here today is a key element in the type of comprehensive care system that we must have in this country in order to provide a healthy life for all of our citizens.
In 2007, the Metro Department of Public Health and Wellness also launched a massive health screening initiative for the residents of West and Southwest Jefferson County. Funds for the $1.2 million initiative came as the result of an agreement between the EPA and the Kentucky Department of Environmental Protection over alleged violations involving the Brown-Forman wastewater treatment plant. Area residents were offered a free comprehensive battery of health screening for the value of $1,400. Healthcare professionals conducted screenings for blood pressure, diabetes, elevated cholesterol, low iron, elevated blood levels, respiratory screenings, and screenings for colon, breast, cervical, bladder, and prostate cancer. More than 2,400 people were screened. More than a third of these had no health insurance, and nearly 1/4 had annual incomes of less than $10,000.
It's a step-by-step process. I mean, if you look at going to your regular physician to go through the same steps, it'll probably take you a couple of days. We can get you through the clinic with all the tests in approximately about an hour and a half. We always want to be in a preventive measure, be in the health department. So if we can identify a problem early, it's a benefit to the client.
In 2008, Louisville was fortunate to have been featured in the award-winning PBS health series, Unnatural Causes, Is Inequality Making Us Sick? The series explores how the social conditions in which we are born, work, and live profoundly affect how healthy we are and how long we'll live, even more than access to medical care, making healthy lifestyle choices, or our genes. The lives of 4 Louisville residents: Jim Taylor, CEO of the University Hospital; Tondra Young, a medical technician and lab supervisor; Corey Anderson, a maintenance worker; and Mary Turner of the Portland neighborhood were used to tell this story. Since the series premiered in 2008, we've used it as a catalyst for discussion in hundreds of dialogues throughout the community on what role factors such as where we live, our education, and our income play in determining our health. These dialogues are helping to inform and shape social policy. Faced with a potential global pandemic, during the winter of 2009, Metro Public Health and Wellness and its many community partners, such as the University of Louisville, conducted an epic H1N1 flu immunization campaign. It conducted drive-through and walk-in immunization clinics at Papa John's Cardinal Stadium in November, and may have set the Guinness Book of World Records for the most immunizations given on a single day on November 11th. It also conducted clinics at multiple other sites throughout the community. Then in late November and December, the department, again with many community partners, gave free immunizations to students and staff in all Jefferson County public and parochial schools, as well as many private schools throughout the area. By the time the campaign was over, the Metro Department of Public Health and Wellness and its partners had directly immunized more than 78,000 children and adults. It also distributed another 228,000 vaccine doses to 351 hospitals and healthcare providers throughout the community, and provided vaccine for an unprecedented 42% of the population. I'd like to thank the people of Louisville for the kindness you have shown my wife Denise and I over the past 7 years. We will always treasure the time we spent here in Louisville. And remember, the progress we've made together over the past 7 years is the result of the efforts of thousands of people. And it's going to take the continued commitment of everyone to carry that progress forward. Health begins in our homes and in our schools and on our jobs. So let's continue to build an infrastructure in Louisville where all of its citizens have the best possible chance for good health and a long life. Let's continue to build an environment where the healthy choice is the easy one. And let's remember, health is a basic human right. Let's do it because our health matters.